In this class, we will discuss about anti-cancer drug. So we have seen the cancer, how the cancer is caused, and what are the chemotherapeutic agents, or as we can say, what are the general chemotherapy which is given in the cancer patients. Now let us see the pharmacology of anti-cancer drugs which are used in the treatment of cancer. So anti-cancer drugs, the drugs which are used in the treatment of cancer are called as anti-cancer drugs. So what are the goals of the therapy? So the ultimate goal of the therapy is to cure. So the cancer, or else we can say the tumor cells, should be cured and they should be removed out of the body. The other one is palliation. So palliation is nothing but the shrinkage of the tumors. So the tumors are shrinked and thereby they are removed out of the body and then insensitive. So the patient should be, if the patient is insensitive, then he has to support for the treatment of the chemotherapy. Adjuvant therapy. So the adjuvant therapy is nothing but the treatment, or else we can say the therapy which is given after the primary therapy, that is after the surgery. So if there are any traces of the cancer cell is present after the surgery or even after the radiation, so in order to remove these cancer traces and in order to prevent the reoccurrence of the cancer, this adjuvant therapy is mostly preferred. Let us see the drugs which are used in the treatment of cancer. So there are two types of drugs, that is drugs directly acting on the cells and the drugs which alter the hormonal levels. So these are the two category of drugs which are used in the treatment of cancer. The first type of drugs are drugs which are directly acting on the cancer cells. So let us see the classification. There are different categories of these drugs. The first classification is alkylating agents. So these alkylating agents are again divided into nitrogen masters. So the drugs which come under this category are miclorothamine, cyclophosphamide, ifosfamide, chloramucil and melphalan. And ethylenimine, the drug which come under this category is thiotepa. The other class of drug is alkyl sulfonate. The drug which come under this category is busulfan. And nitrosoureas, the drugs include carmustine and lomustine. And triazine category, where the drug include dacarbazine. The other category of these classification is antimetabolites. So antimetabolites are further classified as folate antagonist, purine antagonist and pyrimidine antagonists. So let us see what are the folate antagonists. So folate antagonists include drugs like methotrexate, and purine antagonists include drugs like 6-thioguanine, 6-mercaptopurine as well as azothioprine, and pyrimidine antagonists include 5-fluorouracil cytarabine, which is also called as cytosine arabinoside. The other drugs are vinca alkaloids. These are naturally occurring plant alkaloids which include vincristine and vinblastine. The other one is taxanes. So taxanes are also naturally occurring compounds, or even they are synthesized artificially also. And the drugs which come under this category are paclitaxel and docetaxel. The other class of drug is epipodophyllatoxin. So the drug which come under this category is etoposide. And camptothecin analogues. So these are all plant derivatives, and camptothecin analogues include tropotecan and irinotecan. There are various antibiotics which are used to treat cancer. There are various antibiotics which are used to treat cancer, such as actinomycin, doxorubicin, daunorubicin, and metoxantrone, bleomycin, mitomycin, and mitramycin. So these are the antibiotics, and there are various other drugs. There are miscellaneous drugs like hydroxyurea, procarbazine, L-asperginase, cisplatin and carboplatin. So these are the various category of drugs which are used in the treatment of cancer, and these all drugs, they directly act on the cancer cells. There are other classes of the drugs which alter the hormone levels. So the drugs which come under this category are glucocorticoids, drugs like prednisolone and prednisolone derivatives, and estrogens like phosphestrol and ethinyl estradiol, and anti-estrogen drugs like tamoxifen, and anti-androgen drugs like flutamide, and 5-alpha reductase inhibitor like finasteride, and GnRH, that is a gene expression analog like nafiralin and gosralin. So these are not that clinically useful. So the clinically useful drugs are the drugs which are directly acting on the cancer cell. Now let us see the mechanism of these drugs. So what are the generalized mechanisms of these anti-cancer drugs? So if we see, there are various mechanisms by which these drugs are acting. So one of the mechanisms is destruction of DNA or inhibition of DNA duplication. So in a cell, the DNA will replicate or the DNA will duplicate in order to form a new cell. So this process is inhibited by the drugs like alkylating agents and mitomycin C. And the other mechanism is inhibition of nucleic acid synthesis. So there are various nucleic acids in the DNA and RNA. So the expression of these nucleic acids, the gene expression of these nucleic acids decide the category, or else we can say decide the functioning of DNA. So the various nucleic acids which are present in the DNA are adenine, guanine, cytosine and uracil. And whether if we see adenine, guanine, cytosine and thymine in DNA, whereas if we see in RNA, the nucleic acids which are present are adenine, guanine, cytosine and uracil, where thymine is replaced by uracil and RNA. So the inhibition of this nucleic acid synthesis. So if these nucleic acids are synthesized, then only the gene expression or the DNA formation is observed. So this process is inhibited by the drugs like 5-fluorouracil, 6-mercaptopurine, methotrexate, cytarabine like drugs. So this is the pictorial representation. Here we can see the DNA. There are two strands of DNA. So here the DNA is dividing. The DNA is replicating with the help of an enzyme called as DNA polymerase as well as DNA gyrase. So these are the enzymes which are aiding in the replication of the DNA. So with the help of this DNA gyrase enzyme only, the DNA will be replicating into two strands, and that the single strand which is replicated, that forms a new strand, and thereby the new DNA is forming. So this is the replication process of the DNA. So this process is inhibited by the drugs like alkylating agents and mitomycin C. The other mechanism is interfering with the transcription procedure of in order to prevent RNA synthesis. So transcription. So transcription is a process where the DNA is copied into RNA. So the DNA have to replicate, and that has to be converted to RNA, and through RNA the ribosomes are synthesized, and ribosomes are the cell organelles which are aiding in the protein synthesis in the body. So once the proteins are formed, then only the cell formation is taking place. So in order to prevent the copying of the DNA to RNA procedure, that is transcription procedure, if that is inhibited, then definitely the protein synthesis will be inhibited. The drugs which come under this category are dactinomycin, daunorubicin and doxorubicin. And the inhibition of protein synthesis. So if proteins are formed, so there are various pathways like de novo protein synthesis and de novo, as well as there is other pathway where from where the protein synthesis is taking place. So if in order to prevent these, if we prevent these pathways, then the protein synthesis is inhibited, thereby the cell growth won't takes place. So the drug which include in this category are vinca alkaloids, epipodophyllitoxins and paclitaxel. The other one is interfering with the hormonal balance. So the hormonal levels which are altered, so that can be, or else we can say the hormones which are involved, or else the enzymes which are involved in the process of the cell division, or the hormones which are aiding in the cell division, so that can be altered or interfered with the drugs like adrenal corticosteroids, estrogens and tamoxifen. So these are the various generalized mechanisms by which the anti-cancer drugs act. So here we can see the pictorial representation. The first picture represents the inhibition of protein synthesis. So here there are the various sites in the cell where the protein synthesis takes place. So ribosomes are one of the sites where the protein synthesis is taking place. So this protein synthesis is inhibited, thereby in order to prevent the cell division. The other one is, here we can see the DNA is copying into RNA, that is mRNA. There are three types of RNAs: mRNA, tRNA and rRNA. mRNA is nothing but messenger RNA, tRNA is transfer RNA, and rRNA is ribosomal RNA. So the conversion of the DNA to mRNA is called transcription, thereby this process is inhibited, preventing the formation of RNA. Let us see the individual class of drugs. So first category of drugs are alkylating agents. So there are various drugs which come under this category like nitrogen mustards, ethyl enamines and various other drugs. So here what are these alkylating agents? So these alkylating agents, they have an alkyl group. Here we can see the picture of the alkylating agents. The circle indicates the reactive alkyl group, that is RCH2CH2 plus group. So this group is very reactive. What does these alkylating agents do? Once they enter into the body, they react with the nucleic acids of the cancerous cells. So they form some reactive, or we can say they form some intermediate compounds by reacting with the nucleic acids which are present in the cancerous cells, and thereby they prevent the growth. So let us see the mechanism of action of these alkylating agents. So here we can see there is a flowchart representation. So these alkylating agents, when they react with the cancerous cells, that is we can say the nucleic acids which are present in the cancerous cells, they form some highly reactive carbonium ions. So first these alkylating agents, they undergo metabolism and carbonium ion is formed. This carbonium ion is highly reactive in nature. So it has greater affinity for the chemical compounds in order to react with it. And then the alkyl group which is present. So we have seen here the alkyl group which is present, and that alkyl group is transferred to the nucleophilic sites of DNA. That is, the nucleic acids are having greater affinity towards this alkyl group. These alkyl groups, they combine with the nucleic acids and thereby they prevent the cross-linking as well as abnormal base pairing and DNA strand breakage. So if the nucleic acids are inhibited, or else we can say the nucleic acids are altered, then definitely the cross-linkage won't happen and definitely the pairing, the base pairing won't happen. So here the adenine will pair with the cytosine and guanine will pair with thiamine. So this pairing of, or else we can say the base pairing can be not observed, or else we can say the base pairing can be altered. So if the base pairing won't take place properly, then the DNA strand formation will not take place properly, and after once the DNA is formed, the DNA strand breaks and the single DNA strand is formed. So that single DNA, it forms a new strand and thereby forming a new DNA. So this process, each and every step is inhibited by these alkylating agents. So because of that, alkylation even also damages the RNA and proteins. So if once DNA is damaged, so the DNA to RNA conversion, that is transcription process, won't take place. So if RNA are not formed, then definitely protein synthesis is not observed. And because of the DNA strand, or else we can say because of the inhibition of the synthesis of DNA, there will be decreased cell proliferation. That is, the cell division or the spreading of the cell will be decreased. Let us see the drugs of these alkylating agents. So one of the important drug is meclorithamine. So meclorithamine is one of the most potent alkylating agent used, and it is used, or else we can say it is mostly given through IV route, and it is given as a part of MOPP. So MOPP is one of the therapy. It includes drugs like meclorithamine, oncovin, prednisolone and procarbazine. So there is a combination of 4 drugs. So combination therapy is usually given in cancerous patients. So this meclorithamine is given in the combination therapy of MOP, and it is used in the treatment of Hodgkin's lymphoma. So Hodgkin's lymphoma is a type of lymphoma where it is causing, or as we can say, the cancer which is caused to the white blood cells. So the cancer which is caused in the white blood cells or the lymphatic system, so that's called as Hodgkin disease. And the adverse effects of this meclorithamine is severe vomiting, and we can see myelosuppression. That is, the immune system suppression is taking place. And the severity, or else we can say the toxicity of this drug is very severe. The other drug is cyclophosphamide. So cyclophosphamide is transformed into active aldophosphamide and phosphomide. So here each and every drug forms its own active metabolite, or else we can say each and every drug forms its own alkyl group. So here if we see cyclophosphamide, once it is entering into the body, it is transformed into aldophosphamide and phosphomide. These are the active forms of cyclophosphamide. So these groups, they react with the nucleic acids and thereby inhibit their synthesis, and this is administered through orally, and this is mostly preferred in the Hodgkin's lymphoma, breast and ovary cancers. So there is other category of drugs in this nitrogen mustard, that is ifosfamide, but this ifosfamide, because of the longer T half, so if the drug is having longer T half, then the drug remains in the systemic circulation for longer period of time. So because of that, it may sometimes leads to adverse effects also. So ifosfamide, because of its longer T half nature, so it's not most preferred when compared to cyclophosphamide, and it is mainly used in the testicular tumor. The other drug is chlorambucil. So chlorambucil is all these drugs are having the same mechanism of action. So they form metabolites and thereby they react with the nucleic acids, thereby inhibiting the DNA synthesis. So this chlorambucil is given orally, and this is used against the lymphoid tissues, or as we can say the cancer which is caused in the lymphoid tissues. The other drug is busulfan. So busulfan is also given through oral route, and it is used against the CML, that is chronic myelogenous leukemia. So chronic myelogenous leukemia is one of the cancer which is caused to the immune system. The other drug is carmustine. So this is one of the drug which is which is undergoing the mechanism of alkylating agents, and it is preferred through IV route. So till now, these are the drugs which are given through oral route. Only meclorutamine and carmustine, these are the drugs which are given through IV route, and they are very effective in order to treat brain tumors, as well as this carmustine is even given in Hodgkin's lymphoma. The other drug is dacarbazine. So dacarbazine is also, when compared to other alkylating agents, this dacarbazine is different. Why? Because it is altering the RNA synthesis and protein synthesis. So till now, these alkylating agents, they react with the nucleic acids inhibiting the DNA synthesis. But this dacarbazine, it interferes with the nucleic acids which are present in the RNA. So in RNA also there are 4 types of nucleic acids. So instead of thymine, uracil is present. So here the nucleic acids which are present in the RNA are altered because of the drug called dacarbazine. So the mechanism of action is little different when compared to other alkylating agents, and it is used against melanoma, that is a very serious skin cancer, and Hodgkin's lymphoma. The other category of drugs are anti-metabolites. So let us see about these class of drugs. So these class of drugs are S-phase specific drugs. As I told you, there are selective as well as non-selective drugs. So these, we can say these anti-metabolites, they mostly alter only, we can say they can only alter the S phase. So we saw G1 phase, M phase, G2 as well as G0 as well as S phase. So here the S phase, that is synthesis of DNA phase, is altered because of these anti-metabolites, and these are the structural analogues of essential metabolites. So this looks similar to the metabolites which are present in the body. So here the cancer cells, they utilize these metabolites in order for them to grow. So here they look as such to that metabolites, whereby the cancer cells get confused and thereby they take up this anti-metabolites, and these anti-metabolites, they aid in the prevention of the cancer cell growth. They interfere with the DNA synthesis. So S phase is a phase where the DNA synthesis is taking place. So these alter the DNA synthesis, or as you can say, they prevent the DNA synthesis, thereby the cell growth is not observed, and there will be myelosuppression. So it's these anti-metabolites, one of the toxic, we can say the toxicity of these anti-metabolites is myelosuppression. So if they are given in higher doses, it causes the suppression of the immune system. Let us see the drug, that is methotrexate. So methotrexate is a folate antagonist. So here in anti-metabolites we have folate antagonist, purine antagonist and pyrimidine antagonist. So purine, this folate antagonist is methotrexate, and this methotrexate is a structural analog of folic acid. So as I told you, this similarly look like the metabolites which are present in the body. So folic acid is one of the metabolite which is one of the, we can say, one of the main important factor in the DNA synthesis. So as this is a structural analog of folic acid, instead of folic acid, these cancerous cells, they uptake this methotrexate, and this methotrexate, what does it do? Here we can see the pictorial representation. The folic acid is converted to dihydrofolate, and dihydrofolate is converted to tetrahydrofolate with the help of an enzyme dihydrofolate reductase. So this tetrahydrofolate is one of the major important factor in the DNA synthesis. So this enzyme is inhibited by the drug called methotrexate. So if this enzyme is inhibited, then the conversion of this dihydrofolate to tetrahydrofolate won't take place. Thereby the DNA synthesis is not formed. So here leucovorin rescue. So what does this mean? So what does this leucovorin rescue? So it is one of the, we can say it is one of the plant which is used in the methotrexate therapy. So here leucovorin is nothing but the folinic acid. So this folinic acid, once it is administered, it is converted to tetrahydrofolate and thereby the production of DNA synthesis takes place. So leucovorin, what does it do? If a person is taking this methotrexate as well as leucovorin, then the methotrexate won't show its action. Why? Because this leucovorin is having a folate structure, that is it's folinic acid only. So this folinic acid is converted to tetrahydrofolate, thereby the DNA synthesis taking place even in the presence of methotrexate. And since methotrexate can't prevent the enzyme called dihydrofolate reductase if this leucovorin drug is present in the body. So that is the reason these two drugs are not given in combination. So they are used to rescue bone marrow as well as GIT mucosal cells. So in the severity of methotrexate, in the toxicity of methotrexate, there will be myelosuppression or immunosuppression. So in that severity, this leucovorin is given in order to prevent the action of methotrexate, or else we can say in order to prevent the adverse effects or toxicity of this methotrexate. So resistance. So this methotrexate, if it is given alone, it shows resistance. So what does it do? So if methotrexate is given for longer period of time, then the body shows resistance and thereby the affinity of this methotrexate towards the enzyme called dihydrofolate reductase will be reduced, or even we can say it is nullified. So if the affinity is not having, then there will be the inhibition of this dihydrofolate reductase functioning will not be inhibited. Thereby the DNA synthesis can be done, or else we can say the DNA synthesis will takes place even in this even in the presence of this methotrexate. So the diminished entry of this methotrexate into the cancer cells. So if the body is showing resistance towards this methotrexate, then this methotrexate won't enter into the cancer cells, and thereby there will be overproduction of this dihydrofolate reductase enzyme. So if the enzyme is present, or else we can say if the enzyme is overly produced, then the DNA synthesis will be rapid. Let us see the pharmacokinetics of this methotrexate. So this methotrexate is mostly administered through oral as well as IM, that is intramuscular route, or IV route, that is intravenous route, and in some conditions it is also given through intrathecal route, and it is having good oral absorption. So when compared to other routes, when compared to other drugs, if a drug is given through oral route, it undergoes first pass metabolism and thereby the availability of the drug is reduced. But here in case of methotrexate, even if it is given orally, it shows good absorption and there will be cerebrospinal fluid entry, in the sense as we are giving through intrathecal route. Intrathecal route is nothing but we are directly giving into cerebrospinal to the brain, and thereby it directly enters into the cerebrospinal fluid. So what are the uses? So one of the uses is that choriocarcinoma. So choriocarcinoma is a cancer which is caused to the uterus, which is mainly originated from the fetal chorion. So this is through the fetal chorion, the cancer is passed to the mother, and thereby the cancer is spread in the uterus. The other one is tumors of head and neck, breast cancer, acute lymphatic leukemia, that is the cancer which is caused to the lymphatic system, and meningeal metastasis, so wide range of tumors. So in the meninges of the brain, the tumor is caused. So let us see what are the adverse effects of this methotrexate. So the adverse effects is that first thing is that myelosuppression. So the immune system will be suppressed. So because of the suppression of the immune system, there will be severe leukopenia. So leukopenia is nothing but the decreased count of leukocytes. The leukocyte count will be reduced and thereby the immune system will be weakened, and bone marrow aplasia. So bone marrow functioning, the ability. So bone marrow is a place where the blood cells are synthesized. So the bone marrow suppression is taking place, and thrombocytopenia, that is the decrease in the count of platelets or thrombocytes, and it causes GI disturbances and even it causes renal toxicity. Let us see other subcategory of these antimetabolites, that is purine antagonists. So drug which come under this category are 6-mercaptopurine and 6-TG, that is thiaguanine. And the exact mechanism of this purine antagonists are not known yet, but there is only a imaginary mechanism, that is inhibition of the protein synthesis. So here this is the de novo protein synthesis. Here the ribose 5-phosphate, it is utilizing ATP and it is forming PRPP, and this PRPP is converted into IMP, that is inosine monophosphate, with the help of an enzyme called PRPP amidotransferase, and this IMP is converted to either GMP, that is guanine monophosphate, or AMP, that is adenosine monophosphate. So here they undergo different pathways. Here the GMP, where it is converting the guanosine into guanine, and this guanine is converted to xanthan. So finally through all these pathways xanthan is formed. Through this xanthan, uric acid is formed with the help of an enzyme called xanthan oxidase. So this is one of the de novo synthesis pathway which is aiding in the protein synthesis. So these purine antagonists, they inhibit this mechanism, thereby preventing the protein synthesis. Let us see the pharmacokinetics of this purine antagonists. So they are metabolized by xanthan oxidase. So xanthan oxidase is one of the enzyme which is present in the body. So there is a drug called allopurinol. So allopurinol is a xanthan oxidase inhibitor. So if this xanthan oxidase is inhibited, then the quantity or else the concentration of these purine antagonists in the blood will increase. So in that cases there may be adverse effects of this purine antagonist. So that is the reason, if because of the overdose, or as we can say, if the excessive metabolism of these purine antagonists is taking place, in order to prevent that excessive metabolism, allopurinol is given in combination with these purine antagonists. So allopurinol dose have to be adjusted according to the dose of the purine antagonist, and this because these purine antagonists are well tolerated, in the sense they do not show if they are used in excessive dose only, they show tolerance, and there will be mild immunosuppression. So the immunosuppression is not that severe when compared to methotrexate. There will be mild myelosuppression and hepatotoxicity. So these purine antagonists are we can say the purine antagonists are used for longer period of time. It may cause to toxicity to liver. What are the uses? So it is mainly used in the acute lymphatic leukemia, especially which is caused in the children. So acute lymphatic leukemia in the children can be treated by this purine antagonist, and this is given in combination with methotrexate in order to in the choriocarcinoma cancer. Let us see the pyrimidine antagonists. So pyrimidine antagonists include drugs like 5-fluorouracil. So 5-fluorouracil is the main drug which is used under this category, and 5-fluorouracil is the analog of thymine. So thymine is one of the most, we can say, one of the most nucleic acid which is essential for DNA synthesis. So here this 5-fluorouracil, it have the similar structure of this thymine. So here we can see the pictorial representation, where folate is converted to tetrahydrofolate, and this tetrahydrofolate is converted to 5-THF, that is folic tetrahydrofolate, and this uses purines for RNA as well as DNA synthesis. And here this tetrahydrofolate is converted to 5,10-methyl tetrahydrofolate, and this, with the help of an enzyme called methyl tetrahydrofolate reductase, it is converted to 5-methyl tetrahydrofolate. So this is a cyclic chain. Here if we see 5,10-methyl tetrahydrofolate, it is converted to dihydrofolate by utilizing the enzyme called thymidylate synthetase. So thymidylate synthetase is one of the main enzymes which is forming dihydrofolate. So this enzyme is inhibited by 5-fluorouracil and thereby preventing the DNA synthesis. So this folate, dihydrofolate and tetrahydrofolate, these are the main components which are involved in the DNA synthesis. So this conversion of this 5,10-methyl tetrahydrofolate to dihydrofolate is inhibited. What are the uses of this pyrimidine antagonist? So they are mainly used in breast, colon cancer as well as gastric cancers, and they are used in squamous cell tumors of the head and neck. So they are used in the cancer, or else we can say they are used to treat the tumors of the head and neck. What are the adverse drug reactions? So if these drugs are given in overdoses, they cause nauseating sensation and sometimes it may lead to vomiting also. There will be myelosuppression. So all these anti-cancerous drugs have the side effect of myelosuppression. They will cause oral and gastrointestinal ulceration. So these drugs, what does they do? They aid in the excessive secretion of HCl in the body. So if excessive HCl is secreted, it may lead to ulcers in the abdominal cavity. So because of the ulceration, it may also lead to, because of the ulcerations, it may lead to mucosal damage. In the sense, the mucous layer which is present in the stomach, that is getting damaged, and thereby the stomach wall is getting ruptured, leading to the ulceration. Let's see the other category of drugs, that is antibiotics. So antibiotics, there are various antibiotics like doxorubicin, daunorubicin, bleomycin, mitomycin, mitramycin. And see, the anthracyclines are one of the antibiotics used. So what does these do? So topoisomerase 2 is one of the enzyme which is helping in the DNA replication. So here there are two types of topoisomerase enzymes, topoisomerase 1 as well as topoisomerase 2. Here these antibiotics, they inhibit the enzyme called topoisomerase 2, thereby they are preventing the DNA replication. So here here we can see the pictorial representation. The DNA is having, if the drug is given, the DNA is breakdown, or else we can say the DNA is, before it's getting replicated, the DNA is getting breakdown, and thereby the replication of the DNA is not taking place. So that leads to the cell death. So this is how the antibiotics are acting. So these anthracyclines, they have a special characteristic feature that they even damage the cardiac cells. So if they are used in excessive dose, it may lead to the damage of cancer cells, and the resistance will be observed because of the increased effects of the drug. So if overdoses is given, or these antibiotics are used for longer period of time, the drug shows resistance. So these cells, what does they do? They change their structure according to the drug. So because of that, these drugs are showing resistance or tolerance. What are the uses of these antibiotics? So that is doxorubicin, is used against breast, ovary, lung, prostate and acute lymphatic leukemia type of cancers, as well as daunorubicin. So daunorubicin is used in the type of cancer called acute lymphoblastic leukemia as well as acute myelogenous leukemia. The other type of drugs which are used as antineoplastic agents are Vinca alkaloids. So Vinca alkaloids are naturally occurring compounds. We can say these are indole alkaloids. So they contain indole ring in their structure. So these Vinca alkaloids are extracted from the plant called Vinca rosea, which is also called as Catharanthus roseus, and even these plants are mainly observed in the Madagascar region. And here we can see the two forms of Vinca alkaloids, that is vincristine and vinblastine. So here we can see the centralized structure where they are containing indole ring. So this ring is one of the active component of this Vinca alkaloids. What are the mechanism of action of these Vinca alkaloids, or how they are showing the anti-cancer activity. So here these microtubules are, or else we can say the microspindles are one of the components which are used in the cell division. So here the microspindles or the spindle formation only aids in the division of the cell. So if the spindles are not formed properly, then the division won't take place. So here it binds to the microtubuli, suppression of the microtubular dynamics, and thereby the metaphase arrest takes place. So metaphase is a phase in the cell cycle where the spindle formation is taking place. So here the spindle formation is taking place only when the microtubuli in the cell is generated. So if the microtubule is not generated, then it won't, the spindle fiber formation won't take place. So here these vinca alkaloids, if we see, they are binding to the microtubuli, and if they bind to the microtubuli, then the spindle formation won't take place, thereby the metaphase, there itself the cell cycle is ended. Taxanes. So taxanes are also one of the plant derivatives, and they are isolated from the bark of a plant called Taxus brevifolia. So the common name of this plant is Western or Pacific yew. So this is a common name, and the botanical name is Taxus brevifolia. So here we can see the taxanes are almost having the similar mechanism of action of vinca alkaloids, but they are having different binding site. So here we can see the pictorial representation. Here these vinca alkaloids, they are binding to the microtubule, and thereby they are preventing the microtubules, they assemble together to form the spindle fibers. So here these vinca alkaloids are preventing that. But if you see taxanes, they are preventing the microtubule disassemble. So here once the microtubules are forming, they assemble together to form spindle fibers, and again they dissociate to form the different spindle fibers in order to replicate. So here the disassembling of this microtubule is prevented by these taxanes. So the binding site is differing, but the mechanism is the same. So the other drug is podophyllitoxin. So podophyllitoxin is also a plant derivative, that is the drug which comes under this category is etoposide. So the podophyllitoxin is derived from a plant called Podophyllum peltarum. Podophyllum peltarum. So this is from this plant, this podophyllitoxin is extracted, and see here this is the structure of podophyllitoxin, and this acts by inhibiting the enzyme called topoisomerase 2. So we saw the topoisomerase 2 functioning. It affects the DNA replication. So this step is inhibitor, or else these podophyllitoxin, it inhibits the enzyme called topoisomerase 2, thereby inhibiting the DNA replication. And it is used as an antiviral as well, antiviral agent, and it is used to even in veneric warts also. And the toxic effect, if it is used in excessive doses, it may lead to the ineffectiveness of these anti-cancer drugs. The other plant extracted derivatives are camptothecin. So camptothecin analogues are used, and these are extracted from the plant called Camptotheca acuminata. So this is one of the Chinese plant, and from these Chinese plant, these camptothecin analogues are derived. So this camptothecins, initially they are discovered from these plant, but later they are even found in the other species of Camptotheca. So there are various species of Camptotheca plant, but initially it's found in acuminata type of species, but now they in various other species also it is found. And these also act by the mechanism of inhibiting the topoisomerase 2, which is one of the main enzyme used in the DNA replication.